Precision genomics is the concept that I think we all natively understand, that we have features in us that are genetic. We have risk factors that remind ourselves of our family risk factors. We have appearance that remind us of our family. But precision genomics is trying to go a little bit deeper into what is the information that's available within my genome, within the genetic information I have, that can be used to not only predict my risk of disease, but ideally prevent disease. So PreventGene is a concept that we have information, our genetic information, that could be used for prevention and improvement of health outcomes. So what we're doing at PreventGene is trying to drive the eventual goal of all of us having access as Albertans to information in our genome that would be used to identify risk for disease and tailor treatment. So PreventGene is the beginning of this. So we're taking a group of individuals who are at moderate risk of cancer, mostly breast cancer, and cardiovascular disease. So we're testing out how interested they are in this information, but also what broader information do they want? Do they also want to know risks of other diseases? Do they want to know their pharmacogenetic risk, which is how does my body metabolize drugs? And should I be careful about some medication that I might be sensitive to, get more side effects, or not get the same response to medication because I metabolize it different? So what we're doing is we're trying to build out a program that eventually leads to population-level genomic screening for risk factors that are modifiable, that improve health outcomes. So it created a great starting point for us, but the goal is to think not just of starting with people who are at risk of disease, but moving to the whole population. What do I have as a 40-year-old or a 50-year-old or a 70-year-old or maybe even a 20-year-old that I might want to be aware of that would change my outcome? So the healthcare system is built on being reactive. We spend most of our resources in the healthcare system treating individuals who have significant illness and need acute surgery, need acute treatment. So the bell curve of cost is high at the really later stages of disease. Our goal is to shift that curve. We want to move upstream to look at what are our risk factors, how are they modifiable, and that'll be good for the system in terms of cost. It'll be good in terms of outcomes because we won't have as many people with disease that is preventable. So the privilege we have in programs like PreventGene is the support of philanthropy. Philanthropy is always the engine of cutting-edge innovation. Without philanthropy, we can't drive into spaces that the healthcare system doesn't have the resources for, and honestly, traditional research doesn't either. So if you want to push the edge of innovation, if you want to drive true system change, true impact on health, philanthropy and organizations like the Calgary Health Foundation are really the engine behind this change. Thank you to the Calgary Health Foundation donors. Your support is just incredible.